Hello everybody, welcome back and thanks for tuning in again to another episode of Tips, Tricks, and Helpful Hints with Dr. Mathew Jensen. Okay, you guys asked for it. Today we are going to talk about what do cavities look like. As always, if you like our videos, please subscribe. Tell your friends about us and don't hesitate to comment down below. We want to hear from you and we want to know what questions or topics interest you. Now, before we get to some pictures and some videos of what cavities look like, let's quickly talk about how cavities are found and diagnosed. Cavities are found and diagnosed by your dentist one of three ways. The first way is visually. When your dentist is looking in your mouth and doing an examination, he will sometimes see obvious signs of cavity and decay. Another way, you all have seen the little instrument, the one with the little hook. That is called an explorer. That helps us to find cavities that may not be easily seen that can be felt in the deep fissures and crevices of our teeth. And the third way that cavities are diagnosed is by an X-ray. For example, many cavities that occur between your teeth are not readily seen or felt with the explorer, but they can only be diagnosed by X-ray. In all cases, many of these cavities are not felt or they're not causing pain, but your dentist can review with you at which time it does need to be treated to avoid pain and to avoid further problems. Now the part that you've all been waiting for. What does a cavity look like? Can you see cavities in your mouth? And at what point will they cause pain? So I'm going to show you a series of pictures and videos to show you what exactly cavities look like. So first of all, I'm going to show you a picture of cavities that can be seen in your mouth that are obvious, larger cavities that need treatment. Here it is. You can see many cavities begin or start in the crevices or what we call the fissures of your back teeth or your molars and premolars. These next pictures are of cavities that are more subtle or harder to see. As you can see in the fissures and grooves of these teeth, they might appear to be a little discolored or even stained. As we talked about earlier, microscopic bacteria is what mixes with the sugar that we eat to produce the acid that causes a cavity. Therefore, because of the extremely small size of these bacteria, sometimes these cavities will start deep down in those fissures and grooves, and you can't see them until they start to grow and get bigger and grow outward. This is a picture of a cavity that's in between your teeth that you most likely will not be able to see that needs to be diagnosed by your dentist. And these last pictures are of cavities that are diagnosed by X-ray that you may or may not see in your mouth. Okay, a quick lesson and review about how cavities are formed. Remember, sugar alone does not cause cavities. Sugar must be acted upon by the microscopic bacteria that live in our mouth normally. Those bacteria metabolize the sugars that we eat to produce an acid, and that acid is what dissolves and decays our enamel. If you like this episode, please follow us on Facebook. Subscribe to our channel. We want to hear from you, and if there's other topics that interest you, let us know in the comments below. Again, thanks for joining us, and until next time, keep brushing.